Today we are going to learn how to make a diagnosis of asthma. First of all, we need to have positive clinical history suggesting asthma. Then one out of these three tests positive. So clinical history plus one out of these three tests positive. Only one positive, then we can tell asthma. First test is forced expiratory volume in first second, which is measured by spirometer. It is more than equal to 12% increase following administration of a bronchodilator or steroid. If we give bronchodilator or steroid, there is if the increase is more than equal to 12% or 200 ml, then we can call this asthma. And if greater confidence will be gained if it is more than 15% or more than 400 ml. Second test is peak expiratory flow. Peak expiratory flow diary. It is measured by peak expiratory flow meter, PEF meter. If the diurnal variation is more than 20% on more than equal 3 days in a week for 2 weeks, then we can tell this is asthma. So the patient will measure consecutively 2 weeks. If the diurnal variation is more than 20% on 3 days, more than equal 3 days in per week, then we can tell this is asthma. And third test is post expiratory volume in first second. It is more than equal 15% decrease after 6 minutes of exercise. Patient will do 6 minutes of exercise. If the forced expiratory volume in first second is more than equal 15% decrease, then we can call this asthma. So we can diagnose asthma by clinical history and one out of these three tests positive. One out of these three tests positive. To make a diagnosis of asthma according to the NICE guideline 2017. If the patient is more than equal 17 years, we should exclude occupational asthma first. After exclusion, we will do a spirometry with bronchodilator reversibility test plus fractional exhaled nitric oxide (FeNO) for all patients. So spirometry with BDR plus FeNO. By spirometry, we can tell the patient's obstructive or restrictive spirometry. Obstructive asthma is obstructive disease, so we can find out with this spirometry FEV1 by FBC ratio less than 70%. Positive BDR test, improvement in FEV1 more than equal 12% after giving bronchodilator. So this positive BDR test. We can differentiate asthma with COPD by this positive BDR test and the positive FeNO test. This is confirmatory for asthma. If there is diagnostic uncertainty, we should diagnostic uncertainty like normal spirometry or obstructive spirometry, a positive BDR, but a FeNO less than equal 39, then we will do peak expiratory flow variability test, which is 2 to 4 weeks for 2 to 4 weeks. So peak expiratory flow rate means we will find the diurnal variation. If it is more than 20%, then we can tell this is asthma. So for 5 to 6 year patient, we don't need to do the FeNO first. We will do spirometry and BDR test. If spirometry is normal and obstructive spirometry with negative BDR, then we will do the FeNO. For 5 to 16 year, FeNO must be more than equal 35 for positive test. So in asthma diagnosis, we need positive spirometry with a BDR test and positive peak flow rate. This is enough to diagnose asthma. Now we will know how to give order of test in asthma. First, we will give FeNO and spirometry. By spirometry, we will find out about the obstruction. If the spirometry shows obstruction, we will do the BDR test. If still after doing FeNO, spirometry and BDR, the diagnosis is uncertain, then we will do peak flow variability for 2 to 4 weeks. If still the diagnosis is uncertain, still, then we will do after doing peak flow measure, then we will do histamine, methacholine, direct bronchial challenge test. So we need to refer to do this test. And if the test is not available, then if the challenge test is not available, then we will suspect the patient as asthma. give you the diagnosis after treatment. So this is all about diagnosis of asthma. Thank you.